Welcome to another edition of Health Matters, a presentation by the Ministry of Health. Glad that you're with us on today's program. We've got an interesting program for you. This episode, we'll be focusing on the 2026 Lesser Antilles Medical Assistant Team, LAMAT. They're here in Guyana, and we're going to be talking about their scope, their impact, and the collaboration between local and international medical team. I've got here a panel of doctors and leaders, and to my right, I've got Dr. Anand Persaud. He's with us at the Ministry of Health and visiting out of the United States as part of the LAMA team. I've got to Dr. Persaud's right, Dr. John Fortunato, and to his right is Renee Swift. She is the Deputy Commander for the team, and to her right is Dr. Robert Toney. Doctors, Commander, welcome.
Thank you. Thank you. Thank you.
And welcome to Guyana. Now, for our viewers who might not be familiar with the Lesser Antilles Medical Assistant Team, tell us about your mission and why is it important for Guyana and for your team?
Yes, thank you. It's a wonderful opportunity to be here to collaborate and to work together as a medical mission. This is the third time in Guyana, so we have been in partnership and learning from each other. So it's just a wonderful opportunity for the Department of War, military medicine, and also learning from the Guyanese medical professionals.
It's very much a knowledge exchange on both sides. And I think really, as we kind of strive to become more nimble on the military side, we're also learning the needs assessment both in the Guyanese and the American side. So it really is a collaborative effort. And I think, in healthcare and medicine, it's kind of when the boundaries actually kind of fall off as far as clinical scientists. So it's a really great chance for us to actually work as collaborators, as partners in care.
Yeah. And Dr. Persaud?
No, I mean, they've covered pretty much what it is in essence. But essentially, like they said, it's a good opportunity for an interaction and a collaboration between our colleagues in the United States and in Guyana. It's a knowledge exchange. It's an opportunity for them to work in a distinct environment and for our teams to have exposure to some of the newer, more advanced procedures and mechanisms that they have in place for patient care.
This collaboration began in 2023. How has it evolved since then?
So in 2023,
and this is a large contingent.
It is the largest contingent we've had so far. I know we started in 2023 with a small group, and then we had a much larger group in 2025, and then of course it's in 2026. But we've expanded not only the number of persons, we've expanded in the services that we deliver. So we've seen, for example, in 2023 we had just surgery, but now we have dental, we have ophthalmology, we even have some amount of social work that's being offered through the leadership of the LAMAT team. Mm-hmm. So it's expanding, and we're glad about that because it offers more opportunity for exchanges amongst our local teams and of course the visiting team.
And if you can speak to a bit of that, Renee, how you see it over the years with your knowledge from 2023 to now?
Yes, so now that we have that muscle memory, we're able to increase our capabilities. We know what we bring to the table and what the Guyanese bring to the table and what we're able to learn from them and what we're able to share. So we're just able to go out into the community. We've expanded. We're in more locations, and just our reach has grown over the last few years.
And that's a good point that she raised. To add to that, when we started in 2023, we were at the Georgetown Public Hospital Corporation only. In 2026, we're at the Kendron Regional Hospital, we're at the West Demerara Regional Hospital, Diamond Regional Hospital, we're at West Demerara Regional Hospital, we're at the Georgetown Public Hospital, and we're at the Chelly Jagan Dental School. So much more facilities, much more personnel being given the opportunity to interact and engage.
I think these types of missions that think evolve as medicine evolves, one of the things that I found is that we actually have more in common than I thought, including innovation and technology. It's been a subject that we've talked about, how we can collaborate. I have an interest in telemedicine development globally in my practice in Chicago, and again, there's an interest here in developing that. And again, this is where we can, the world becomes a very small place, doesn't it? So you can really collaborate and build these types of platforms and actually bring Guyana to the United States, Guyana to Europe, just with technology.
And we're already doing that, right?
Exactly.
Exactly.
In several locations, which I think is sort of underscores that it's just beginning. But there's a mutual or interest on both of our sides to do that, both in the United States and here.
What we'll do, we'll take a break, and when we come back, we'll have more for you on health matters. Welcome back to Health Matters. One member of this team is Dr. Robert Toney. First time here in Guyana. Dr. Toney, welcome to Guyana, welcome to our program.
Thank you very
Tell
much.
us what a day like has been so far, and you're just a week into your mission.
So I'm in primary care, so I'm not, what I do is not necessarily as exciting and new, but I like to think of primary care as the bread and butter of medicine. So I see a lot of the regular day-to-day common health conditions. So my typical day is our team arrives at the hospital around 8 o'clock in the morning. We have what we call a morning huddle where we discuss any particular topics that need to be ironed out for the day and decide where everybody's going to go work. And typical is a typical primary care day. I go to the clinic and basically seeing the patients from geriatrics to pediatrics, common colds, infections. Typical day actually from my practice in the U.S. At the end of the day, we wrap up. We do what we call a huddle or a wrap up in the evening to discuss anything that's happened unique throughout the day, any plans, any changes we need to make for the following day, and head back to the hotel.
Something that resonates, something that it will take away a takeaway moment for you for the past week.
Like I said, primary care is the bread and butter. It's not any exciting new surgery, but for me, just seeing the diversity of patients, how appreciative the patients are to see the Americans come out here and volunteer our services to help with expand their ability to offer health care, but no earth-shattering takeaway moments per se.
Okay. Any challenge with the Guyanese dialect, as the case may be?
You can be honest.
I have had a few cases where they are speaking English, but I'm not quite getting the story.
Right. Yes.
So that had been a slight challenge, but not a big challenge. And again, there's staff there to help me kind of work through that.
Excellent. And Dr. Fortunato,
Yes.
your day, what's your day like?
There's some similarities. I mean, for one, we start with a kind of early morning briefing to go through the plan of action for the day. We have dentistry, surgery, public health, myself in pediatrics and gastroenterology. So we try to go through kind of goals of the day, cases for the day. Handling both inpatient and outpatient, I usually, after we complete that, I'll round with the pediatric service and sometimes with the gastroenterology service. And it kind of gives me that hands-on, we're working, again, as a team to do that. So we do our cases, we see our patients, we're very, again, flexible about getting as many cases as we can. And then I like to spend about an hour or so a day with the director just so we could talk about strategic planning for the next day, the next week, and then for future collaboration. Just one of the things that came up from the Minister of Health was the idea of partnering with universities in the United States, and I'm a faculty at a university, and so that's a kind of part of our day, both patient care hands-on, but also logistics in terms of now and future strategic planning.
Do you see this as also passing on knowledge, information to team members at your site?
Yes, absolutely. I mean, like I said, the education is bilateral. It's both ways. I've given some talks. Some of our members have given lectures and briefings, and we get feedback from the community as well, from the hospitals. So again, it's a shared learning experience.
Right. Any feedback, Dr. Persaud, based upon the week's implementation so far?
No, I think it's a lot of planning that went into the mission for sure. We've covered a lot in terms of getting the team to in country and then getting them to the sites. We've had a good experience so far. It's an exchange, it's a work in progress, and we're getting better every year. Hopefully in 2027, 2028, it'll be perfect and much larger.
Your progress feedback you've got from the team so far?
I visited all of the sites that we have staff in, and so it's been interesting and wonderful to be able to talk to Guyanese providers and also our providers to see some differences in the care, and then also how they're learning from each other. And so we've been able to sit in on some of the education piece and to just figure out for the next year or the next time how we can improve or increase capabilities. So it's been a great experience.
And yes,
I was going to say, there seems to be an organic camaraderie that develops, which I think is how the best teams work, mutual respect. And so I think that's become pretty apparent in the first week, that we're comfortable working together, comfortable giving feedback and constructive feedback for among the groups. So it's been positive.
one thing I've got to ask you is how different you've seen your practice here based on your practice in the United States or wherever you would have gone to other missions.
Yeah, I think what's interesting is in some places the equipment is sometimes a challenge, but I think what I've mentioned to the director and to the trainees that I've spoken to is that it really allows you to use your mind and think clinically. So in a lot of ways, technology, diagnostic equipment is wonderful to have, but this is kind of what drives our decision making. So in a lot of ways, there's a very thoughtful process that goes into each patient about the possibilities. So knowing what you have and what you don't have and what you need to do. Again, I think it really makes you more flexible in being able to manage patients, particularly complex ones.
And that's Dr. Persaud speaking very much of managing patients. Can we learn from them? Because they're here, strange territory for them, but they're managing. Can our locals also benefit from that?
Well, I think in the aspect of managing patients in relatively, I don't want to say low resource settings, but settings where it's less advanced, for example, like in the US. We do that on a day-to-day basis. The teams that come in from the US, they also get to learn a little bit of how we do that, what are some of the different methods we implement. And it's a learning progress because they teach us about different technologies that they might use or how they might approach a different issue. And so it's an exchange. That's the focus of the collaboration. It's an exchange of knowledge. But I think fundamentally to highlight on that, I know we're speaking a lot about the doctors and the exchange amongst the healthcare professionals, but I thought it important also to highlight the patients. So the patients essentially are the primary objective of the entire mission. And we can say so far we've seen a lot of progress in terms of the work we've done, in terms of the surgery so far, the procedures we've completed. And in many cases, we're doing things with the team that we've never done before. Maybe in a later program, we can probably list those out, some of the new things that we did, because we're still halfway through the project. But also apart from that, it's not just the new things that we're doing with the team, but just the quantity. It's increased based on the manpower that we have available through the team. They're on the ground, they're working with us. So I think essentially that's the focus we want to put on this, is that we're learning a lot from each other, but it's benefiting the patients. And the more facilities that we go to, the more specialties that we have in country, we're able to serve a larger group of the population.
And has there been any special surgeries performed so far?
Well, I haven't had a chance to review in detail all of the reports, but I know they're working in their teams. We have surgical teams, we have dental teams, we have ophthalmological teams, and they're looking at some of the more complex issues to cover. And hopefully, maybe the next program, we can give you a list of some of those things. But I recall in 2025, when we had the mission, they had done one of the surgeries for a patient. It was a pediatric patient. I believe the child was maybe just a few months old. It was the first time we had done that surgery. And the prognosis going into that surgery for that child was that he or she would never be able to see. And now we know a few months ago we checked in again, and at least partially, at least maybe 50 or 70% from one eye, that child is able to see. So we have some amount of good success in the things that we've done, and we're hoping to achieve much more.
Dr. Toney, what would be your take in imparting your knowledge to your local team here in Guyana?
Again, in primary care, the medicine is remarkably similar. There's not a whole lot of technology that goes into necessarily what I do from day to day. I think the biggest thing that the team has brought in terms of primary care is the ability to see more patients and to be able to offer more services in a more timely fashion. I think that's been the biggest positive that we've been able to implement to the Guyanese population here at Diamond Regional Hospital.
And Dr. Persaud, is there any special way that patients are selected, or they're just walk-ins?
No, not necessarily. So in the case of day-to-day routine activities, for example, in primary health care, as you come into the consults, in whatever order you come in, you're seeing. Now, in the case of surgeries and other procedures, it would depend on the waiting lists and the level of priority that you were given. So it would depend on the types of procedures you're going to be doing. If you were on the waiting list, who was there first? And that is where we prioritize patients that get seen. But on a day-to-day basis, no. Any patient can walk into a facility and they can have exposure to the team.
What was some of your interaction with your patients?
I think to kind of start with one of the things that I thinking outside the box was sort of the cultural awareness aspect of things that I've begun to appreciate. So I do see a lot of pediatric patients. We resuscitated a premature infant. I've seen a lot of patients with some chronic related issues, but I've noticed that I think to me the most important thing is knowing your patient, knowing your patient and parent. And so I've had a very positive experience. We have a patient that I may likely do a procedure on next week from I believe District 7. So again, patients coming from a distance. But I found that interaction and that sort of face-to-face contact and really engagement to be really to be critical. So again, we've had a few complex cases. We've had a few patients who are coming for follow-up. It almost feels like being at home in some ways, having your own return patient, and I think that's been a really nice positive aspect from a continuity of care standpoint.
So, Dr. Persaud, they will move on into various other regions.
So for this mission, they will be at the sites that we've mentioned before, and hopefully maybe the next LAMAT 2027, we'll have them in other regions.
Okay. I want to go back to Deputy Commander Renee Swift and talk about what's the long-term goal here, 2023, 2025, 2026, and you did mention a next time. And so there must be this collaboration to bring some strengthening on both sides of the aisle. Tell us a bit about the long-term plan here.
This partnership is enduring. It has only continued to grow. I've been a part of this organization and with the Department of War and the Air Force and the Air Force Reserve. This is my second time doing the LAMAT, but I've only seen that it's growing and the capabilities are growing. We're learning from our missions, and so looking at doing further afield outreach at other clinics as we learn what we're able to do. But I only see this evolving and growing and our partnership deepening.
Okay. And have you been in other missions which you can compare to the Guyana and the others?
Yes. So last year I was the deputy commander for St. Kitts and Nevis. And so I was on the island of Nevis in their A&E, in their accident and emergency. And so there were some similarities, but there were also some differences. But overall, it's been a great experience, and I love that I get to do this.
Right.
Maybe going back on the question of where we see it going to.
Right.
I mean, I'm not allowed to speak on behalf of my colleagues from LAMAT, but I think one thing I can highlight, which is a fact, is that from where we started to where we are now, we've even added a new component, and that new component has to do, in this LAMAT, we have, through the work of the United States Air Force and the LAMAT team, been able to bring on board a team from the University of Miami, and they will be here in country, and they'll be doing a training, mass casualty management training with about 60 to 70 persons from in-country. So the reason why I mention that is that it's not just about clinical care, but it's bridging the gap between academia, practice, and then the knowledge exchange that we have between the countries. So going forward, we hope not only to have more specialties or larger teams, but it's to have consistency in our collaboration. So we get in contact with different universities, so we can have exchange programs, we can have trainings, whether it be in country, out of country. And I think that's the direction we're looking at this to go. It has to build capacity, it has to ensure that it's something more sustainable. It's not just seen as a one-off, but we're building the steps necessary in order to ensure that we have day-to-day interactions with our specialists and our colleagues and our friends in the United States.
Doctor, what would be some of the takeaway from from your colleagues, because they also would come here for a learning experience? What do you think will be that for them and even for yourself?
I mean, for my colleagues, I think that the big high-level item is the thinking outside the box, and I think that's a tremendous attribute to this because really what you need to be creative, and that's where innovation comes, isn't it? And so I think the real thing is, we have a problem or a task that needs to be solved. We address it. We come up with the possibilities and the mechanistic solutions, and we may not have everything that we need, but we still have to make it work. And I think even from a military standpoint, that's kind of the lesson from DOW with us, is that how do you think on your feet in those circumstances? So to me, if you can solve those problems, when it's not a perfect circumstance, I think that makes us all a lot stronger. So I think that's the real takeaway message. I think the other thing too is, again, what are the next steps? You brought up the University of Miami. I teach. I'm a faculty member, so the idea of being able to continue to do that. We have global partners at my university in Chicago, and we do this. I've been in several countries in the past year. So again, it opens up that possibility, as was discussed, for research possibilities, for clinical mentoring possibilities, and then also for, again, clinical collaboration for challenging cases. Again, just to underscore the world's a small place, and I think that's really what we're finding, is that there are a lot of things we can contribute with that.
Commander Swift, he mentioned the R word, research. Is that important?
Research is always important.
Especially on these missions.
Yes, to bring back the lessons learned, to look forward. There is a carry forward piece that we've learned just from last year, what we were able to bring. And so we've made sure to include ophthalmology and kind of expand that capability. But there are things that we learn from a training perspective as well. COVID taught us that supply chains are fragile. So we may not be able to always have the logistics train that we have. So we need to learn and, memorize this information and use it going forward. And so this is great information and exposure for our members.
Mm-hmm. Is that so? Good exposure for the entire team?
Yeah, from my primary care perspective, again, I think it's made us rely a lot more on your physical exam skills. Back in the States, sometimes with all the technology, you get away from the basic physical exam. You can really do a lot more with just a good physical exam without ordering x-rays and lab tests. And when those resources are not available, it's important to be able to manage the patient appropriately without all the sophisticated diagnostic testing. So that's been the big takeaway for me.
So essentially you're saying we have a lot of skills, right?
Oh yeah.
Right, and that's good. So what we'll do, we'll take a break, and when we come back, we'll have more for you on Health Matters. Don't go away. Welcome back to our program, our final segment, and we'll be speaking to members of the Lesser Antilles medical assistant team. They're here in Guyana, collaboration with the U.S. government and the Guyana government. And we'll be talking about their first week here in Guyana. They've got about 2 weeks more to go. And so it's a lot of work. And of course, speaking off camera, we're hearing some differences with tropical medicine. And of course, we're there from up north, but some similarities. Welcome back again, gentlemen. And Dr. Off camera, we're talking about something new sometimes, working in a tropical country where you're just a couple of degrees off the equator. And so that can also be challenging to some members of your team.
Right. I mean, these are things we learned about in medical school and training, but things like dengue fever and malaria, we know them, but we don't necessarily have firsthand experience. This is actually my fourth mission from globally, and each place I've gone, including Guyana, you bring something back with it. So, my attention to things like dengue fever in patients who don't have other presenting symptoms, it was a quick learning curve for me on that end of things. So yeah, it's bringing back knowledge that at one point was more just kind of hypothetical knowledge and actually having
Textbook.
Was that?
It was textbook.
You go from textbook to hands-on,
Yeah.
and I think that really is where you learn the most. And so I think it's been a benefit. It benefits us for each mission we go on.
Right. And so Dr. Toney, they're working in a tropical environment.
Dengue is the same thing in primary care. Different ways to think and practice in different environments. So it can change your management. It kind of broaden your horizon on what to think about clinically when you're in different regions.
Commander Swift, as we look into the future, 23, 25, 26, and you say it's going to be next time, what would you recommend, based upon just 1 week of task so far, that can happen as we strengthen both sides?
Well, we've been flexible, and so being able to move our people around the different facilities has been monumental to get them greater exposure to, because each facility is very different what they provide and the patients that they see. So maybe being able to expand into different sites and to different locations around the country, I think will be beneficial and will be something that we look at in the future.
Is there something good to go in the future, Doctor?
Yeah, I think the continued, even offline discussions and sort of across the borders in collaborations in preparation, anticipation. I think preparation is always the best way to be effective. So, I read quite a bit, but you read what you read and what actually translates into boots on ground is a different scenario. So I think that's an opportunity for growth as you think about what the next steps are. Is how do you focus your knowledge base before arriving in country?
What would you think, Dr. Persaud?
Well, I can't avoid the fact of probably just stating this. His Excellency the President and the Honorable Minister of Health have both outlined that there is an intention to push healthcare in Guyana towards being a world-class healthcare system. And the infrastructure work has already been started. It's progressing. We're doing a lot of advancing our technologies, new equipment. We have telemedicine. We're working on bringing in some of the newer equipment, for example, like x-rays and all those things. But an important component to that is building relations, collaborating, and knowledge building. So by using LAMAT, for example, we are not only looking at it as, like I said, a one-off, an activity where you come to the country, you do about 2 to 3 weeks, you spend at a few sites. We're looking at the long-term collaborations that we build amongst our teams, which leads to, progress in academia, in training exchanges, in knowledge exchange, but something, of course, is a little bit more stable and continuous. So going forward, I would say that we not only want to speak about quantity of persons coming or the quantity of specialties or expanding or work in the different regions, but we're looking at making it more concrete, building relationships with universities in the United States of America and along with our university here in Guyana and our different teaching institutions and hospitals.
Dr. Persaud and the LAMAT team, thank you very much for being on our program, and let's hope that the rest of your mission will be certainly a success. Thank you for being a part of this edition of Health Matters. I am Nazim Hussain. Do join us again next time. Until that time, stay well.